everyone, my name is Sonya Krishnan. I am a current infectious diseases fellow at Johns Hopkins and a recent graduate of the Osler Medical Residency Training Program. I have had the chance to participate in numerous global health experiences, which have shaped who I am and my career aspirations. Leading up to residency, I studied abroad in Tanzania as an undergraduate and was able to complete a research project studying HIV. In college, I spent an additional summer in Honduras. Following college, I was able to work at the National Institutes of Health in the HIV pathogenesis unit, where one of my projects was collaborating with researchers in Kenya to study markers of immunologic non-response in people with HIV who are on antiretroviral therapy. When looking for a residency program, I was interested in continuing to expand on my global health experiences. I was drawn in part to coming to Hopkins for residency because of the Pathways program, especially the Global Health Pathway. I ended up joining the Global Health Pathway, which is run by Dr. Yuka Manabe, at the end of my intern year. The Pathway was such a wonderful experience, and the members of the Pathway became a second family, as there are numerous events that you attend together, and you all have a common interest in global health. Dr. Manabe is amazing. She is an infectious diseases clinician scientist with decades of experience completing HIV and tuberculosis research in sub-Saharan Africa, with a focus in Uganda. She became a mentor to me and the other members of the Pathway, holding numerous one-on-one sessions throughout the following 2 years of residency, where she sought to better understand our long-term career aspirations and provided counseling for what steps we should take to be successful. Without the Pathway, it would have been hard for me to know how to initiate global health research at Hopkins. Dr. Manabe took the time to connect me with several faculty members who were completing research abroad and had an interest in working with residents. Through this connection, I met Dr. Bob Gilman, who has studied Chagas in South America for decades. I ended up getting to go abroad to Bolivia for 6 weeks during my second year of residency, and was involved in a clinical trial studying markers of Chagas cardiomyopathy in Santa Cruz. The Global Health Pathway also provided help with applying for a Paul S. Sleetman travel grant, which I received. This completely covered costs of travel and living within Bolivia. Through the experience, I made lifelong friends in Bolivia and was recently able to reconnect with them when they traveled to Johns Hopkins for a research seminar. The Pathway affirmed my interest in infectious diseases and global health, and provided an important experience to discuss while applying for fellowships. I'm now a third-year infectious diseases fellow studying predictors of adverse TB treatment outcomes with a focus in India. I would highly recommend the Global Health Pathway to anyone, whether you have a long-standing interest in global health or you want to use it as a chance to explore and experience a potential future career.